Gynecological cancers are cancers of the women reproductive organs. Those are the vagina, the vulva, the cervix, the uterus, the fallopian tubes, and the ovaries. That depends on several factors. For example, their age, their family history is extremely important. If their mother, sister, or grandmother have had cancer, all this impacts their chance of developing the cancer. And there are cancer syndromes that occur in certain families. For example, there's the breast ovarian cancer syndrome, which is related to BRCA gene. It's a BRCA1 and BRCA2 gene. And we identified those women through their family history and some genetic testing. It is not clear the reason why we have an increase in frequency of these cancers, of endometrial cancer in the younger population. It is thought to be related to lifestyle factors, obesity, environmental factors, for example. Obesity, for example, increases several factors, increases the inflammation in the body, increases insulin, has characteristics that increase the division of cells, especially of the cells of the inside lining of the endometrium. We have hormonal factors. With obesity, there's an increase in estrogen that circulates in the body. So there are a number of factors that come with obesity that increase the chance of developing endometrial cancer, for example, but several other cancers in the body also. Each of these cancers have a unique way of being screened. For example, cervical cancer, we start Pap smears at the age of 21. So from the age of 21 to the age of 29, the recommendation is to get a Pap smear every 3 years. We do not usually check for HPV status between the age of 21 and 29 because it's extremely common, and most of the time the patients get rid of the HPV naturally. After the age of 30, from 30 to 65, we change the screening to every 5 years, and we do co-testing. We do HPV testing as well as the Pap smear. And if both are negative, we can repeat that every 5 years until the age of 65. We do not have a screening test for endometrial cancer. For ovarian cancer specifically, a patient that carries the BRCA1 or BRCA2 gene mutation, we start the screening at the age of 25, and usually with yearly ultrasounds together with the CA125. These are not very accurate screening tests, but it is the best we have at the current time. Between the age of 35 and 40, we recommend patients with the BRCA1 gene mutation to have prophylactic removal of their fallopian tubes and ovary. And for the BRCA2 gene, which usually ovarian cancer occurs slightly later in this population, we recommend that those patients consider removal of the ovaries and the fallopian tubes between the age of 40 and 45. So how do we take care of these women that carry a very high risk of cancer? For example, patients that carry the BRCA1 or BRCA2 gene. We have a specialized clinic, which is the high-risk clinic, where these patients are monitored regularly and given the appropriate screening tests and scheduled for their mammograms, their MRIs, transvaginal ultrasound, yearly checkups. It does not replace their primary doctor, but keeps these patients on schedule. We have it all comprehensively dealt with by a nurse navigator, doctors, and genetic counselors that can really take care of these patients in a comprehensive fashion and keep them on schedule to prevent them from developing the cancer or detecting it very early in curable stages.